Hi friends. This is Dr. Ravi Kamapali. I'm an infectious disease, wound care, and obesity medicine doctor practicing in Georgia. And as I get time, I tend to do this short live sessions on Facebook and try to post it on YouTube. And today I was thinking about what to talk, and basically, I was thinking as to what is going on with the complexities in healthcare and why people get so confused, and why there is so much confusion about different processes that happen in healthcare. And it's a loaded topic, but from a person who understands a little bit of chronic disease along with infectious disease and wound care and obesity medicine, I just wanted to bring and throw some light on different aspects as to why it is so complex. Number one, we humans are not an like easily evolved beings. We are complex humans. Then that we are a complex genetic material in the presence of different microbiome, and microbes express ourselves genetically differently. So we each are different, and hence our response to external stimulus is totally different. So what I want to kind of discuss is why say our responses are different for say infection. And for example, say if you have a infectious disease like the COVID of the time, or the virus of the bug of the day, and essentially why does one person have a certain effect and another person have a different outcome? We can say that it depends totally on how our immune system reacts. Now, what I try to emphasize is a multifactorial approach. Now, healthcare as is being delivered is trying to be simplified. So because it's a complex process, people end up trying to simplify it because they think that people are naive and they don't want to understand, or they want a quick fix. Yes, people want quick fix, but if healthcare providers and healthcare systems have a time and effort that they can put in and empower the health professionals to do what they are really trained to do, I think then they will be able to help the end user of the service that we are providing better. And so sometimes we end up blaming the person who is receiving the care, you see. And when somebody is receiving care, they are coming to us for being helped by us. Now, they don't know everything. So even myself, take my own case. I'm a physician and graduated in '95, and from my state back home in India, in Andhra Pradesh, and in southern India though, and basically came to US in '97 and ended up becoming infectious disease and wound care doctor. And until from '95 to 2015, I was doing amazing work from an acute care standpoint, becoming obese myself. So it so happened that it took my becoming obese, making me think as to why things are so complex, and I ended up becoming obesity medicine doctor and trying to change myself. So why am I doing this whole videos is to simplify this process. So if you think about it, I said healthcare is complex. Now, coming to why somebody reacts differently. Say an infection happens, and say if the person does not have diabetes, they react one way. If they have diabetes, they react a different way. Obesity, they react a different way. So what happens is our immune system is made up of some cells called T cells and B cells. And just mumbo jumbo, forget about all these cells. But at least what we have to understand is that there is some soldiers that are out there to protect us. Now, there are some soldiers that are out there that know who are friends, and now they know they have to know who they are foes, who they are enemies. So what happens is, once you get a bulk of infection or bulk of exposure to external organism, then these foes, these friendly cells then go out there and try to protect us depending upon the bulk of infection. Now, once you get a lesser bulk, then obviously they think, oh, this bulk is this is not causing us trouble, and they will create antibodies. So what happens is, when we have fat accumulating, so we are eating carbohydrates, and over time we are accumulating this fat, and our own T cells, the immune cells, goes, and once we reach this amount of fat, our fat pot that we have, mostly it's in the gut, it becomes full, then our own T cells try to go there and try to kind of take it out, and sometimes they are doing that job. And at that point, when our fat pot is full, then there comes the complexities, like you become obese, you become diabetic. So our T cells, those fighting soldiers, are stuck doing the job somewhere else. Now here comes the bug of the day, which for now during the COVID time it's COVID, but during flu time it's flu, or it could be regular bacteria. Now these bacteria, these fungi, these other issues then develop like something called as lipopolysaccharides. These lipopolysaccharides are the system, these bacteria secreting these polysaccharides that are kind of are secreted normally by regular bacteria in our gut. Now, when our immune gut lining that is not able to protect us, that is, if we have leaky gut or other problems that are associated with gut dysbiosis, that is, means our gut bacteria is not right, or we are not eating the right food, and our immune system is working somewhere else where then it cannot come and protect you. So that ends up causing the real problem where your soldiers are doing something else. Now your virus that, or the bug of the day, the fungus or bacteria of the day, can enter, and then your soldiers are not able to take care of that, then they spread to other cells. Now our immune system then realizes, like say for COVID, initially it hides from the acute immune response, and hence then there is delayed response. So now the immune system kind of overwhelmingly comes and tries to protect you, and that's when all the immune system and cytokine storm happens. So that is from a complex explanation, but I just want to also tell you there are many other topics that we can talk about. Say, I call this a disease triangles concept, which we can talk about each topic, which could be, say, an immune system that is one thing, immunology, and there is another thing called lipid system, and that is one aspect of the disease triangles concept. And then there is basically our gut microbiome is the third thing. But in reality, the other things are lifestyle and our genetic system and the environment. So these are 6 other things that really have an amazing impact on how our body reacts. So this human organism or human being that we are created as a complex being cannot be simplified. So hence, when somebody comes and asks a doctor to simplify and give them a 2-point solution so that they can go change themselves, it is so hard for doctors and health professionals to communicate it. And once you get only 15 minutes to try to do that, and you try to make that timeline that you have to sit within that time and try to provide that solution, it's hard. And when when people like me are trying to do these things, it's harder, and the systems kind of make it a real solution that is very harder to implement. So in trying to do this, we're trying to do something amazing in healthcare, one person at a time medicine, apart from mass medicine mindset. So we will be continuing to do this and help as much as we could. And hopefully that was my message for today. And hopefully next week, if I have some time, I will try to join. But thanks Shivaram, Natalie, and Tulsiram for joining. And thank you very much. Take care. Have a good day.